اوكي. بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله. انا عبد الله رفاعي. انا عضو بالإديوكيشن كوميتي بسامز. صار لي بشتغل مع سامز تقريبا 6 سنين من قبل ما اجي حتى على امريكا. بنشتغل في بالسامز. رح احكي عن المشاريع اللي حاليا بنشتغلها مع الإديوكيشن كوميتي. اول شيء بدي ارحب فيكم جميعا اليوم السبت أوغست 6 2016. معنا الدكتورة ميسن مفتاح. رح تحكي عن تجربتها بالستيب 2. هلا قبل ما ابلش حنبهكم انه في على اليمين رح تلاقوا في مربع خاص للاسئله، فيكم تكتبوا اسئلتكم وان شاء الله نحن رح نجاوب على اغلب الاسئله او حسب الوقت، بس نحاول نجاوب ان شاء الله على كل الاسئله اللي رح تنسال للدكتورة ميسن اذا في حدا عنده اسئله. وإن شاء الله راح تكون الويبينار مسجلة وراح نرفعها على القناة تبع Education Committee على اليوتيوب. فحبلش حكي شوي عن السامز. السامز إلى جزئين. طبعا كمنظمة فيها قسم، فيها أكثر من مشاريع عم تشتغل فيها. شيء تعليمي اللي نحن بالإديوكيشن كوميتي بنهتم أكثر خاصة بالأطباء اللي هلا راح يفوتوا على الماتش، او الاشخاص اللي هن هلا خلال الريزدنسي. وفي له قسم هيومانيتيريان، خاصة في ظل الأوضاع اللي عم تمر فيها بلادنا. الله يخفف علينا وعليكم جميعا. هي منظمة نون بروفيت نون بوليتيكال، وعندنا جزء educational و humanitarian as I said. فيها تقريبا ما يقارب ال 4000 ل 5000 طبيب حاليا. عندنا بالإديوكيشن كوميتي في عندنا أكثر من 13 مشروع حاليا عم يشتغل. في عندنا الفيسبوك بيج اللي أغلبكم عضو فيها، أو اللي حابب ينضم ممكن يبعث لي مسج. في عندنا annual scholarship program بنساعد فيه الأشخاص اللي بفوتوا على الماتش كل سنة. عندنا observership program للأشخاص اللي ناويين يفوتوا على الماتش وبدهم يعملوا شوية clinical experience قبل ما يفوتوا على الاختصاص. وبنعمل أكثر من أونلاين workshop أغلبكم شافوا إنه ممكن مسجل موجودين على قناتنا على اليوتيوب لنحضر السيريان ميديكال ستودنت والريزيدنتس قبل ما يفوتوا على الريزيدنسي بموضوع الماتش والانترفيوز. بالمشاريع اللي انا كنت فيها من زمان قبل ما اجي على امريكا، لما كنت ميديكال ستودنت بجامعه دمشق، كان في عندنا اونلاين كورسز. طبعا هذا المشروع تطور، صار له اكثر من فيرجن، بس حاليا موجهه اكثر شيء الاونلاين كورسز للاشخاص اللي بداخل سوريا، خاصة بالمناطق اللي فيها أشخاص انقطع تعليمهم الطبي وهن مضطرين يمارسوا ويساعدوا أهاليهم بداخل سوريا. في كتير مشاريع تانية موجودة على صفحة الفيسبوك، على الصفحة الأساسية لسامز، فيكم تشوفوها. لمحة صغيرة عني. أنا حاليا أنا خريج جامعة دمشق. تخرجت بال 2011 واجيت عملت ريزنسي بيونيفرسيتي ميامي. عملت انترنال ميديسن باطني، وهلا من شهرين بلشت قلبي بنفس الجامعه بنفس المستشفى بيونيفرسيتي ميامي ببام بيتش. آه، راح احكي هلا لمحه سريعه عن الدكتوره ميسن مفتاح. هي born and raised بأمريكا. حاليا هي سنة رابعة بميديكال ستودنت بيونيفرسيتي اوف ساوث فلوريدا بتامبا. وما شاء الله جابت سابع أعلى سكور بتاريخ اليو اس ام ال اي. حتى انه الدين تبع الميديكال سكول بعت لها رسالة هناها على علامتها العالي كتير، اللي يعني قلائل جدا بتاريخ الفحص اللي كلنا قدمناه وبنعرف قديش صعب جابوا هاي العلامة العالية جدا. والدها كمان طبيب، دكتور عزام مفتاح. وحاليا هي إن شاء الله راح تقدم على الماتش هاي السنة، وهدفها أكيد الالتيميت جول تبع إنه تساعد أهلها وإخواتها السوريين، خاصة اللي عم يمروا بظروف كلنا بنعرفها بسوريا وبدول الجوار بسوريا، خاصة بتركيا ولبنان والأردن، وكلنا بنعرف قديش في حالات صحية يعني كتير صعب إنه العناية الطبية بهدول البلدان إنه تقدر تتكفل فيهم. فدائما أي حدا إذا حتى فيكم قادر على إنه يتطوع. سامز عندها كتير مشاريع للأشخاص اللي حابين يتطوعوا بجهدهم أو بخبرتهم الطبية بمساعدة إخواتنا بسوريا، سواء بسوريا أو داخل سوريا أو حتى حوالي سوريا. فنحن هلا رح نبلش، رح اعطي الديسكتوب للدكتوره ميسان، وتقريبا مده البرزنتيشن حوالي 45 minutes او اقل، وبعدها حناخد اسئلتكم. وان شاء الله مثل ما قلت رح تكون الاسئله رح تلاقوا في محل على اليمين فيكم تكتبوا فيه اسئلتكم، وانا رح جاوب عليها باخر شيء. وراح تكون ان شاء الله مسجله. حاليا عم نسجل نحن البرزنتيشن. فراح اعطي المايك هلا للدكتوره ميسان. اوكي، تفضلي. هلا اعطيتك المايك والميكروفون. تفضلي دكتوره.
Okay. السلام عليكم. أنا اسمي ميسان. شكرا كتير اليوم على هالفرصة. I'm gonna be talking mostly in English just because my training is in English. But if nobody understands anything, you can just ask a question and I'll talk really slow. You guys can ask me anything in Arabic. I mean, I understand and I speak. It's just the medical terminology. Most of my training has just been in English, so I just wanted to put that disclaimer out there before I get started. Um, okay, so today I'm doing like I guess a webinar on USMLE Step 2 prep, basically what resources that you have available, and then sort of what I did and what my recommendations would be for your prep when you want to take the exam. So this is just like an outline of basically what I'm going to be talking about. So the first thing is, I guess, just an intro about the USMLE Step 2 format. It's 8 hours long. It's an hour longer than, it's one block longer than the Step 1, but you still get the same amount of break time. So it's a little bit more exhausting compared to Step 1. It's the same thing. You have the intro in the beginning, and then if you skip that, you get 60 minutes of break. If you don't, you just get 45. And then you have these 8-hour blocks. So recently, whoa, I'm sorry. Okay. So recently in June, they made these new changes to the USMLE Step 2 CK. So what they've been doing, and there's like some like they've been having these experimental type of passages on the tests before, but now they've officially made the change where when you go into a block, it tells you to check the number of questions that you have, because it used to be 46 questions every single block, but now it can vary. I had blocks where it was like 40 or 43. I know people that had blocks that were like 20 questions long, and what they do is basically the question stems are just significantly longer, and they'll have like one stem and then 5, 6 questions associated with it. So it just requires a little bit more, I guess, reading comprehension skills and stuff like that, which is unfortunate because, you know, you can't just use your medical knowledge to answer the question. It's more analysis of the information that they're giving you, kind of taking from some of the like MCAT-based questions, which is the admission test that you take to get into medical school. So that's the biggest change that they've done. But otherwise it should be the same. It's the same information. There's no really change to that. It's just that there's unfortunately these longer question stems that you are going to have to go through on the exam. And yeah, that's pretty much it. So I guess just to talk about the general materials that are out there, the most important thing that you can use, or like the foundation of all of your studies, should be the UWorld question bank. I mean, I know everybody says this, but there's actually studies out there, like in the literature, that say that doing questions is the only thing found to actually improve your score. And like reading a particular book, there's no book superior than the other, no study method that's superior than the other. It's just the more questions you do, the quantity of questions, there's actually a measurable amount increase in your score that you get over time. So, I mean, that would be my recommendation. And then there's also these so as a medical student, the way that US medical schools work, we take these shelf exams. So during the year we practice by taking these subject-based like NBME practice tests. So it'll just focus on one subject. And I can show you what the website looks like. Sorry. Okay. Right here. So I know for US graduates, the website's a little bit different. We do everything through the MBME. I don't know how foreign graduates do it exactly, but I'm sure you guys have access to the practice tests. If not, somebody can please correct me. But basically, when you go online, there's the clinical science, like the self-assessment practice test, which is the step 2 practice tests that you can take, which are like the 4-block practice tests. I'm sure everybody knows about those, but then there's also something called the Clinical Science Mastery Series. So basically, sorry, this is not. So basically what comes up is that you'll just have these 100-question practice tests that you can buy. They're like $20 each, and they're specific to each subject. So there's like medicine practice test, there's pediatric, OBGYN, psych, neuro, so that if you are like weak on a particular subject, that you could just take a practice test specific to that subject. There's also, and then other like general things that people use. I know Master of the Boards is like something that people like to use. Personally, I didn't really use it. There's a first aid also for step 2, but a lot of people, from what I've heard, is that it's not nearly as good as first aid for the step 1, so it's not something that I would, focus on too much in terms of prepping. So then in regards to UWorld in particular, no matter how you study, if you take anything away from today, you have to do it twice. I mean, I know that's like my recommendation, but I almost feel like this should be mandatory for everybody, because it's so dense, there's so much in the explanations in terms of, the algorithms. They talk about all the guidelines. It's the most up-to-date study prep material that you're going to have access to, and it's a bunch of questions, and it's the closest questions that you're going to get to the step 2 questions anyway. So I mean, my recommendation is, if you're over the year studying and during you just focus subject-based, do like tutor-based question blocks, lay your foundation, use books that would be associated with each subject if you're weak on them, and then once you're in some dedicated study time, like 2-3 weeks off, or however many weeks off that you're taking to just study for step 2, that's when you would do your timed random question blocks, which I'll get more into like the schedule, how I did it later, but this is like something that you should try and implement into your study plan if you can, because this is just honestly the best resource. If you didn't have to buy anything else, I would just buy UWorld and focus on that. So then for subject specific materials, for internal medicine, I feel like Step Up to Medicine is probably the most high yield resource that you can purchase to study for the internal medicine stuff. I mean, the step 2 is primarily a medicine exam anyways. If you had to focus on a subject, this would be your priority, but just be careful, because in the book there are some discrepancies between Step Up to Medicine and UWorld, and if you had to pick which one was the one to go with, it's always UWorld over Step Up to Medicine. Just in terms of questions, UWorld will never steer you wrong, but otherwise it is pretty comprehensive. It's just you know. Yeah, and then for pediatrics, for me, I didn't really use a book for pediatrics just because picked from my rotations and stuff. But a lot of people that I know have used the case files book. I've used the case files for family medicine. So it's just basically like they'll give you a case and then they go through the case thoroughly in the book. And then sort of give you branches off from that scenario and go through it in terms of like, I guess, a step type of review, like what scenarios you would have on your board exam and go through that. That's the only book that I would recommend or that I've heard positive feedback on, though, if you were weak in that. Family medicine, although I read this book, I wouldn't recommend it. I just feel like it's not even in depth enough. Unless you are weak on outpatient management for pediatric and like internal medicine patients and like screening, I wouldn't really recommend this book. I just feel like it's too much extra and it wouldn't be a good use of your time. For family medicine or primary care based questions, I mean, it's a big thing on the USMLE, obviously, to know all of the screening guidelines, and you do have to know the guidelines that are the most recent. So like the hyperlipidemia screening guidelines, when you start screening, this is just as an example, that you would like start screening every 5 years, men age greater than 35, or like what are the indications to start a statin, like that type of primary care stuff, even though these are like recent guidelines that came out within the year or so. You need to know all of these screening guidelines, when you like for indications for a statin, like you have to know that every diabetic should be on a statin, everybody with coronary artery disease should be on a statin, like stuff like that would come up very often in a primary care setting. Screening guidelines for hypertension, so you would check every 2 years in a patient that's 18 years or older. Colon cancer screening, know all the options, just all the options, the frequency, if somebody has like Crohn's or ulcerative colitis, like how does that change your screening? So that's what I would focus on. I mean, it doesn't hurt to go on the U.S. Preventative Task Force website. I can look it up. So I guess U.S. Preventative, yeah. So if you go on there, this is kind of like the go-to for in practice in general in the United States. If you wanted to get guidelines on how to manage any particular thing, this is the website that you would go to. They have all screening guidelines, for PSAs, hypertension, hyperlipidemia, usually anything that for somebody in the primary care setting. So if you need an answer and you don't know, that would be my reference to go to. And that's pretty much it for family or like primary care. For neuropsych, so for psychiatry, because we have a whole rotation in psych, so we have to take the shelf exam on psych, but it's one of those things that's kind of, hard to get a grasp on because you just have to memorize all of the criteria that, that these doctors decided to make up in their DSM-5 criteria. So it's unfortunate, but the USMLE has updated all of their testing questions to go along with DSM-5, but all of the study prep materials are still on the DSM-4 criteria. So for people that don't know what DSM-5 or DSM-4 is, it's just the diagnostic manual for all psychiatric diseases, and they update it ever so often, but DSM-5 is the recent update that came out, I think, last summer. But we're already being tested on it. So when you study, UWorld has updated all of its material already, but all the other books that are out on the market have not updated their material. So you should just, if you look up online like DSM-5 criteria, there's like PDFs that you can find that just literally list the diagnostic criteria for every diagnosis. In psychiatry, it's basically just memorization anyway of all of the diagnostic criteria, and then when you go through a question, like you basically literally are just looking to see if they meet that specific criteria. Like if they're having a depressive episode, has it been going on for 2 weeks? Do they meet 5 out of 9 of the criteria for depression? And then you just sit there counting. So it's really just how good are you at memorizing the diagnostic criteria that they have outlined. But you'll find that DSM-5 is actually a lot easier, more intuitive than DSM-4 is anyway. The books that you can use to study, the First Aid for Psychiatry book is excellent, in my opinion, but it's a DSM-4, so when you go through, you're just going to have to correct. It's not like big changes, but there's like little nuances, diagnoses that have been totally taken out, so things that you wouldn't even have to know. And then if you need extra psych questions, if you're kind of weak on that, the Lang Q&A book is excellent as well, except there's a lot of like extra questions in there that you'll asked, like on like IQ testing and IQ testing and like these weird like surveys or like questionnaires that they used to use back in the day but aren't really relevant for clinical practice now. So if you buy that book, you can just skip those questions. And then the practice, like subject-based, like the practice psych-based exams that are 100 questions online that you can purchase are also just DSM-4. So that's the other, I mean, it's not that stark of a difference. It's just that you have to be aware of those differences because it easily could come up in a question and you don't want to get a question wrong. But all of the UWorld questions are up to date in regards to that. For neuro, I didn't use a book. I don't feel like you need to. The step 1 material the step up to medicine already covers neuro enough that you don't really need an adjunctive, like an additional book to study from. So then for surgery, you must absolutely read the Pistana surgery book. Let me look it up. Pistana surgery. Yeah, I think this is it. So this is the book right here. I think this is like an older edition. The newer one is like this one over here. So you must absolutely read this book. It's the most high yield book that you could get for your surgery-based questions. It just goes over all of the surgical diseases, but even in the end, the 180 questions, they're not in UWorld, they're not in step 1, step 2 format, but they do help cover all of the information that you would need to know. So especially in terms of like ortho management, like certain surgical diseases that you should know that I feel like aren't really covered in any book well enough are all covered in this book. And then there's a lot of like ENT and ophtho that you should know that's covered in this book. So it's certainly something that you must read before you take your step 2. This other book, I read the NMS case book. I primarily read it for my surgical clerkship. It wasn't really for my step 2. It's helpful and it does cover the management of all surgical diseases, but it might just be too in-depth. So unless you're like really weak on surgery, I probably wouldn't recommend it. But most of surgery is just going to be your GI medicine questions, to be honest. And then like the pulm, trauma questions, like those patients that have pulmonary contusions and flail chest or something along those lines. Those are technically all surgical diseases. And then infectious disease, acid-based disorders. If you were to take like a practice surgical exam, you'll find that a lot of the questions are medicine questions really, because all they want you to know is how to medically manage a surgical patient. So I wouldn't really fixate on knowing any surgeries or how to do them. You should certainly know like the indications for certain things, somebody that has biliary colic should get a cholecystectomy. You should know that the indications for appendicitis, like if somebody comes in with appendicitis, they should be getting surgery. If somebody comes in with an acute abdomen, they need a laparotomy and they have to go back. You should know like all the trauma stuff, like the algorithm for somebody that comes in with blunt abdominal trauma. Like the first thing that you do is a fast exam, which is the ultrasound that you do in the abdomen and the chest, and then what to do if the patient is stable. Then you can do you can do a CT scan if the patient's not stable. If the patient's not stable or has blood on the fast exam, then you take them back to the OR. Anybody that comes in with peritonitis, the answer is always that they need to go back to the OR. I mean, certain things like that, like you have to know, like, when does somebody need to go back to the operating room? But if you don't know or can't decide, unless the patient is dying, like has a blood pressure of 70/60 or something like that, 70/40 or something like that, then you should probably go with the more conservative answer, because it's never good to be too aggressive on the board exams. They always like the more conservative answers overall. But definitely know the algorithms for like when somebody comes in this trauma situation, what you would be doing. I think for blunt abdominal trauma, it's safe to say that it's almost always a fast exam, unless they have peritonitis, and then you just go to the OR. I mean, that's just a random, tidbit, but yeah. For OBGYN, I didn't use a book. I just felt like everything was too much. Personally, I don't like OBGYN as a subject, so this was certainly a struggle for me. But I know that I think you guys can get access to the American College of Obstetrics and Gynecology, like practice bulletins. So you have to sign up. It takes some pre-approval. I personally just used somebody else's login to get access to it, but that's where UWorld gets all of its questions from. Like all the topics that they ask questions from are from the American College of Obstetrics and Gynecology practice bulletins. You have to sign up. It takes a few weeks for them to give you access, but I personally feel like that is the best thing that you can use to study for OBGYN. And then the UWorld questions, I felt like, were very comprehensive. Their explanations were excellent. And then as a student, I had access to these things called the ACO quizzes. Let me look that up real quick too. But I don't know if you're not affiliated with a particular university, if you have access to these. So that's something that if you are doing research at a university or something like that, that I would ask around about, be like, or at least try and put that you're affiliated. The biggest thing when you create your login on this website is you have to like put in the institution you're affiliated with, and then have an email affiliated with that institution so that they know that you're actually, affiliated with them. So that's the only problem, is I don't know how you would be able to get access to it. But it's just a bunch of questions, and they're so comprehensive. They have good explanations. It covers all the high points in terms of OBGYN, what you need to know. There's been like a general trend on the board exams where they've been asking more and more OBGYN questions, unfortunately. So it's certainly something that you have to know. And then there's like certain things that you just can't answer based off of like, common sense or just figuring it out. You just have to memorize them in OB. So, like, when do you deliver a baby? Like if mom is diabetic, that you're delivering at 39 weeks, if she's hypertensive or whatever, you're delivering at 37. So it's just certain things that you just have to memorize for, in OB, like they just have certain rules, how to read a fetal heart tracing. 15 rule, you're going to get fetal heart tracings in your exam that like you have to read and say that they're okay or not. You have to know what each like change in the fetal heart tracing means. If they have an early deceleration, what does that mean? If they have a late deceleration, okay, that means she has like utero-placental insufficiency. You need to know all that. You have to know cervical cancer and you have to know cervical cancer and endometrial cancer screening guidelines, like in and out. It's all fair game, especially cervical cancer screening, because it's such a primary care topic, and everybody that's in internal medicine and family's going to be seeing it, you have to know, like, if the patient's 24 and gets this result back, what am I going to do? And it changes based off age. So you certainly need to know. UWorld covers this stuff pretty well, but you still need to know in detail like what the screening algorithms are, because they just seem to like these questions on the exams. They also, on my step 2 exam, have this habit of, like, even if it's not a pregnant patient, even if it has nothing to do with pregnancy, they still give you the whole G whatever, P whatever it is, like their obstetric history, and try and format or formulate every question into some type of obstetric question to throw you off. So it's just, I have my own notes. That's the other thing. If anybody would want a copy of my notes, I can give my email and I would be more than happy to email them to you. I feel like they were comprehensive enough. They might be a good starting point. It just covers all the big topics. So if anybody's wants my notes to study, I would be more than happy to send you those. So for biostatistics, the UWorld questions I feel like are enough. It's really not anything more than what was covered on step 1. So it's the same material, except there's these new questions, which they have questions like them on UWorld, where like you get an advertisement or something, or like a study, and then you have to literally analyze. It's just all about how you can analyze the study, and then they ask you questions like, from this study you can gather that, and then they'll have like 4 answer choices, and based on your analysis of the information that they gave you, you have to answer like which statement that they give you is the correct statement. And there'll be like 1 ad and then 3 or 4 associated questions. And it's this trend, like these questions have been popping up more and more on the step 2. I certainly had questions like that on my step 2. So they're really annoying, to be honest, but you have to know how to do them. I do think the UWorld questions are enough though. Yeah, so that's pretty much it for that. The ethics questions, you just have to like get general trends. You just always answer the one that asks the patient, like you're always asking the patient for more information, like, oh, why are you saying this, or why do you think that this is, or why is that bothering you? It's never referring to somebody else, or you should never just, it's never the paternalistic answer where you like force something on a patient. You never refer to the ethics committee. That's always wrong. So it's just picking up on those trends. And then there's also like things to know. You should know what the requirements are for a patient to meet hospice care. You should know what it means to be an emancipated minor. So if somebody's in the military, if somebody is married, if someone has a baby, they're considered, and they're under the age of 18, they're considered emancipated minors, which means that they can just make medical decisions for themselves, and you do not have to get consent from their parents. And this would be in regards to any medical decision. You have to know all of the things that you can offer to an adolescent under the age of 18. So you can offer, anything for drug abuse, if they're pregnant, if they have any STDs. Those are all things that you can offer without consent to somebody under the age of 18. They'll try and trick you and tell you that a patient is coming in for an abortion. That's something that by law they are required to get parental consent for. But for prenatal care, you can offer that without getting parental consent. Other things that you should know, basically, what are the criteria that you need to call somebody brain dead? You need 2 doctors to sign off on it. Basically all the stuff associated with that. You'll have questions where, that it sounds like the patient's brain dead, and you have to answer that this patient's dead, and then they'll give you other answers about like, oh, the family can decide and make it this big ethics question, but it's really not. It's, if the patient's brain dead, they're dead, and it's not as difficult as you would think that it would be. So there's like other things I would try and get familiar with just some of the healthcare policies. It's not like an like the most high thing, but just be familiar with like healthcare practices, like in the hospital, like in the OR, there's a required checklist. How, if a doctor doesn't want to meet certain criteria or requirements of a hospital, like what would you do in that scenario? Just sort of those types of things. The legal, a lot of the like medical legal things that you should probably just brush up on, because it can easily find its way into an ethics question that you would have to answer. And it's hard when you have it rotated in hospitals and in the United States, to really know what the right answer is. Okay. So this is what's my study plan. So for me, because I was on my clerkship year, like in third year in medical school in the United States, is you just do a bunch of rotations in a bunch of different specialties. So this was the order of my rotations. I had psych first, and then neuro and surgery, and my last rotation was internal medicine. I purposely put internal medicine last because I knew that the STEP exam is primarily an internal medicine exam. So if you had to pick one subject to know really well, that would be, you should know really well. So for psych, I did read first aid. I did all the Lane questions. This was during my clerkship though, so I studied throughout the entire year with my clerkship. So obviously I would go to work every day or school every day from 8 to 5 or whatever my hours were. And then during my free time over that rotation, I would be studying. So it wasn't like this intense studying all the time every day that I was doing. But so I would go home and just go through these materials. For psych, I did the first aid, the Lane questions, I did all the UWorld questions, and then before my shelf exam, because I have required subject-based exams that I take in school, I took all of the practice NBME exams that they had for psych in particular just to prepare for that. And then for neuro, because I had my neuro rotation at the time, all I did was the neuro questions. And then for surgery, I read the Pistana book that I showed you guys. There's also like Sana audio lectures that are circulating if you're more of an auditory or like you learn better from lectures. Then they're circulating. If you need to get a hold of them, you can just email me, but it's literally the book in lecture form. It's not anything extra or special, but if you just prefer to listen to a lecture, that's something that is available. And then the NMS casebook, there's there's also other like practice questions online. I can't exactly remember where I got them from, so I didn't include them. But and then for free surgery, the UWorld questions that are like pertinent are all the surgery questions, the GI ones, ortho, optho, ENT, derm. I mean, if you're studying for step 2, you're going to be covering all this material anyway, but if you take a practice NBME, those are the topics that you should expect to be on the exam. So for OBGYN, it's the same stuff that I mentioned, the same resources. I did those during my rotation. Pediatrics, I literally just did the UWorld questions. I didn't read a particular book because I didn't feel that I needed to. For family, it was the same UWorld questions, and then for internal medicine, I read Step Up to Medicine and then did the UWorld questions. So that's basically what I did throughout the year. And then I had my own dedicated study time. That was 2 weeks. So I took a practice test, and then I took 3 to 4 days to review subjects that I hadn't seen in a while, which was basically OBGYN, psych, and surgery. And then after that, I reset my UWorld because I had finished it by the end of my clerkship year. I finished it completely, doing it subject-based and tutor mode. I reset the whole thing, and I did 8 blocks a day, timed, to really simulate the testing like scenario or the testing environment. So I would just sit there and do 8 blocks, time, random. Don't do them question-based, because when you're in the exam, you're getting a random set of questions. You're not going to get them flowing all in the same subject. And then I would, at the end of the day, just review the ones that I got wrong. And then I would just do that literally every day for 2 weeks. And then every week I would take a practice test and just see how I was doing, like how much progress I was making over the week. It's really intense. I didn't take that many breaks, but it's only for a 2 week. It was a 2 week period of time. I know that 2 weeks is kind of short. I mean, some people take 3 weeks or 4 weeks, but it was just a very, very intense regimented study schedule in order to get me into like the mode and the scenario of just sitting at a desk for 8 hours, because it's just so exhausting to sit there and to keep your stamina up for that long. So I think that that would be my best advice the closer you get to your exam, is to have this dedicated study time where you're just, you know, doing question after question after question. And you shouldn't, after you've established your foundation, you shouldn't be reading books anymore. It's all about answering the questions and strategies and just focusing on that. The 3 practice tests that I took, so there's 4 practice tests that are online. There's forms 3, 4, 6, and 7. I took 4, 6, and 7. I feel like 4 was, I feel like, easier than step 2 was. 6 was on par or just a tad easier, and then I feel like form number 7 was incredibly difficult. It was just so hard. It kind of gave me, like, just because I took it so close to my exam, if you are an anxious person, I don't know that I would recommend taking it, because a lot of people see a drop in their score and it might make you feel like you're doing worse when you're not. So just keep in mind that Form 7 in particular is just a very difficult exam. So if you take it and you do worse, I wouldn't freak out. And I would be careful to take it if you feel like you're the type of person that's going to get anxious if you do worse on a practice test. So so basically my recommendation is, it's kind of just what I did, but if you don't have a clerkship, you would just do it on your own time, is to just go through UWorld subject base and read books based on what you're weak on, and just do them tutor mode, take detailed notes. On UWorld, there's a note-taking feature that's on the side, so if you just click on the little sticky note tab and type in your notes and save them, they actually all save. So if you go into like the utilities tab, or I think it's the utilities tab, but then you can generate all of the notes that you've written for every single question into one document, and it can actually read all of them later. So if you're the type of person that likes to take notes and review them later, I mean, it's just an easy way to like take notes as you're reviewing questions, and then you'll have a nice review sheet at the end for you to review. But yeah, just do your subject-based review. I would keep internal medicine closer to my like exam date, or I would make that my priority during the entire study period. Again, because that is the most important subject on this exam. And then even though I don't know how, if you're like doing research or whatever, I would still take out like a 2 or 3 week period of just dedicated study time where you're not working, you're not doing anything, and just make a really strict schedule. Like, I'm going to wake up at 8 a.m., I'm going to do this amount of question blocks, like from 8 to 12 is going to be 4 question blocks, then you have your lunch break scheduled. I know it sounds kind of strict, but the more regimented you are studying, the more you're going to get through all of this material, and you're going to be more efficient. It's just, you know, you kind of get caught up in things and waste time if you don't have this like strict schedule. And then I would start that time with a practice test to see where you're at, review your weak subjects like briefly, and then I would just literally just spend the whole time doing UWorld questions. I wouldn't really focus on reading any books or doing anything extra. It would just be UWorld the entire time, just so that you can get into the like habit of answering questions all the time. And then I would aim to finish UWorld the second time around before taking your exam. So that's pretty much it for like in terms of studying. I do have some practice. I guess I would open it up to questions now. I have some practice questions that we can go over if you guys want to, but we can start with questions first from you all if you want.
Thank you, Dr. Mason. That was really great. And thanks, actually. This was very thorough. And I want to say something. I want to ask you to actually thank you for the initiative for this lecture. And it's really great. I think I've been, I did my exam about probably 8 years or less. So I've been out for a while for this exam, but you did a great job for that. So thank you so much.
Oh, thank you.
So for the questions, I have a question from Mr. Ahmed Nana. So he says, my step exam is in 4 months. I already done with 35% of the USMLE ward, done with the first aid twice, and read Kaplan and Golden. I think he's talking about step one. Uh,
Okay.
Kaplan and
Okay.
Golden a year ago. And not recently. Do you think that I could only focus on your assembly word and first aid, or I should read Kaplan and Golden again, along with your assembly word and first aid? And
Is this is this for step one?
yeah, he's asking actually about step one.
Okay. I would just focus. So I mean, for step one, what I would recommend is making first aid and you world a priority, and then literally just annotate. So what I did is you can take your first aid and go to like Office Depot or and then they'll like take off the binding and hole punch it for you so that you can just take out the papers and write notes on it. I mean, that's what I did. I don't know, but and then I would just focus on UWorld. But for step one, I feel like Pathoma is essential. And if you haven't done Pathoma, that's something that I would do, and then just focus um, on what do you call it, on UWorld. I just think Golian Golian is he gives you these nice tidbits and stuff, but he's not comprehensive enough, so I wouldn't focus on that again. And then Kaplan focuses on all these like it's too in depth and just too many details that it's not going to be the most efficient use of your time to go over Kaplan again. So I would just do UWorld first aid, and I feel like Pathoma is a must, especially if you're weak on pathology, like pathophysiology and stuff like that.
Okay.
Yeah.
Another question. Uh, what's the average score during taking the assembly word for each block usually?
For me,
Yeah, I think they're concerned. Looks like when you do the first aid, you don't score well initially, and they were just wondering what's the average score usually, so they don't get worried. And the
oh, I think I don't know. From what I know is that if you're doing scoring in like the 80s, you're doing great. I mean, for me, I never really because I just throughout the year do things in type of a tutor based mode. Like I go into the questions really not knowing anything, so I don't have high expectations for my scores. But then when I reset the question bank and I'm doing them timed, that's when I'm like, okay, I should know everything by now. And then if you're in like the 80% and higher range, I would feel very comfortable and I wouldn't be worried. Even in the 70s, I mean, U World questions are pretty hard, but if it's less than the 70s, then and you already finished your studying completely, then maybe you should be worried. But if you just started studying or if you haven't read anything yet, I mean, you're not going to do that great, but it's okay because you're using them to learn. You're not using them, to assess your knowledge. That's what practice tests are for. I wouldn't really focus on that. I would use the NBME practice test to assess where you're at,
I see.
if that makes sense.
How many reviews I should do for USM Award?
I feel like if you do it right, it should be two times. Like if you sit there and read every single explanation, but at least the first time you go through, and then the second time, like really review the ones that you're getting wrong. I feel like 2 times is sufficient.
Okay, thank you so much. Uh, second. And then I took both USM Lord assessment and MBME assessment, Form 6, but the score was very different. USM Lord score was much higher. Which one is more accurate?
Uh, is this like the UWorld? Because UWorld has practice tests too.
I
Is
think
that?
he did the USMLE Word assessment and the MBME, and
Uh,
he had the like discrepancy in the scores, so he wasn't sure which one is higher, which one is more accurate to the real life.
um, the NBME ones are more accurate. From what I know, the UWorld ones overestimate your score. Not for everybody, because when I took them for step one, they did not overestimate my score. It was like it was just like my NBMEs, but for most people, they overestimate your score. And then I don't know why the U World like practice exams are not as good as the question bank, but that's just something that I've noticed. The NBME ones are going to be the most accurate in terms of how you're doing. For my step two, I took, I think I, my first one I took before my 2 weeks of dedicated study, I got a 250 something, I can't remember. And then for Form 6, I got a 269 or 267. And then for Form 7, I got a 269. Wow, that one was just ridiculous, so difficult, but it's like the closest that you're going to get. And then everyone says that you're going to get within 10 points of your practice test. So if I get a 269, that means on my step two, I should get from a 259 to a 279. Like that's what you're going to get on your exam.
Okay, great. I'm old graduate since 2004. How much score in step two CK I have to look at in order to have a good chance in pediatrics and dermatology? I will an- I will attend in December before taking step one. So I
Okay,
think
wait,
yeah, he's
wait. So
looks like he's taking the step two before step one, which is a habit we have in
no,
we.
yeah, I was actually let me just go to the end. So, because I had some tips. So that's what I got from a lot of foreign graduate before I took my step exams. A lot of like the foreign graduates would tell me, take use step two material to study for step one, or like take step two. I know a lot of foreign graduates do that. Personally, I wouldn't recommend it. I understand that you all graduate and you just came off of your clinical rotations and it's like fresh in your head, but even though step two is very important, step one is more it's very important and you certainly should not brush it off, but step one is all it's kind of more important than step two in a lot of ways in terms of matching. And then the material on step one, it needs more time because it's so much basic science stuff that you never really use anymore. I would really just use I would recommend taking step one first and making that the priority before taking step two. I know it's like, oh, I just want to get it out of the way or whatever, but it's just not as important if step one is not done yet. And then it's just totally different materials. I mean, you would be using the materials are better for step one. I mean, you have Pathoma. There's this new thing called Sketchy Micro and Sketchy Farm, which are excellent for micro and farm. And then you have First Aid, which is like excellent for step one. It's not that great for step two. You have all the UWorld questions, so I would just make that a priority over step two, and I wouldn't use step two material to study for step one. There's just so many resources for step one, and the step two material focuses so much on medical management, which you're never going to be asked that on a step one exam. And then it doesn't address any of the basic science stuff that you need to know, like the biochemistry and like the immunology that you would need to know on step one, it's just not on step two. So if you use step two materials or your step two foundation to take step one, it just doesn't, like, it's helpful to know the clinical stuff because everything makes sense, but there's just so much basic science that you don't get covered in step two that I just don't think it's a good idea. I mean, personally, you know, so I don't know. That's just my opinion.
Okay. That was great. Next question. What do you think the time frame should be for the Pistana surgery book?
Um, I feel like it's such an easy read. Like, it's not difficult. It's literally just these are the things that you need to know, and it doesn't. So it took me a few days to go through, like 1 or 2 days to read the whole thing and do the questions, because even the questions are not difficult questions. But I mean, if surgeries, that was after I had my whole surgical clerkship. So if surgery is not something that you've seen in a while, or it could take 3 days maybe. I mean, it's not that many pages. The font is really big. The pages are really small. I mean, I feel like 3 days is more than enough to get through the whole thing, to be honest.
Okay. Next question. Uh, could you please give us your email to get the notes you're telling us about? Uh, I think you can send me your email. I will post it on the event page on Facebook, and so everyone can get the benefit of that.
Okay, okay, yeah, yeah, I'll do that. Okay,
Yeah, just later text me your email, and I will post it on the Facebook page. Uh,
okay.
Next question. Um, my name is Alexi Yusuf. I'm a sixth year medical student in Syria. I'm planning to study either cardio or ortho in the United States. What do you think my chance to get an ortho residency in US if I have a great CV and step to score over 260?
I
That's
mean,
a
those are
tough
great
question.
credentials. I think the thing in surgery, like the surgical subspecialties, it's a lot of like who knows who. So my advice would be that you would have to do rotations in ortho, like at different institutions and get letters because, you know, like if you have all the credentials, which it sounds like you do, that's the only thing that I would work on. It's a lot of like who, which person in the ortho community do you have advocating for you, or speaking on your behalf, saying that you're a great student, because sometimes at some point it's becoming more about connections after you have all of the credentials that you would need, especially as a foreign graduate. You would really need to have great letters of recommendation and have somebody in the ortho community that can like speak on your behalf to other people. And it's a lot about networking. I mean, cardiology with the 260 and all those you should easily get into an internal medicine residency. It's just once you're in, it's all about your research, and then you have to try and get into the best internal medicine program that you can get into, because it's certainly easier to get into a cardio program if your own hospital has like a cardiology fellowship. I mean, I'm sure Abdullah can probably speak more on that since he's a cardiologist, but from what I know, it's about your research, and if you have a cardio program in your own hospital or at your own facility, it's easier to make the right connections and to get the letters that you would need to match.
Yeah, as Dr. Mason said, basically for cardiology, you want to aim initially to start with, of course, internal medicine residency. We don't have here the integrated or like the combined training as we have in Syria for cardiology. So for cardiology, you have to go initially to internal medicine. It's 3 years training, and as Dr. Mason said, uh, try to aim for a program where they really have a training program in cardiology, because that will make easier on you, and you can have your connections at that time and do your research and know more people in that department where they can really help you to be accepted. Cardiology really, uh, really, probably it's the second most competitive fellowship in internal medicine, probably right after GI. In the meantime,
Yeah,
it's
that's
uh,
true.
yeah, it's at the top with hematology, oncology, GI, and cardiology. Those are the three top most competitive fellowships. But what makes it, well, I mean, to have a great CV for cardiology, you need to have some research and publications that shows your truly genuine interest in cardiology. In addition to, if your program does not really have a cardiology fellowship, try to work more on publications and research, and knowing more people would really help you. Plus, probably if you had a couple of interviews during the residency match, and even if some of them they don't have the cardiology fellowship, try to go to a fellowship, try to go to a residency program that at least has the university name. So there's a lot of residency programs. They are university-based program where you have basically it has a university name in the name of program, because the cardiologists they're all about the repetition. So that's a big thing here. So they want someone, if they want to accept someone, they want someone who are basically trained in a residency in a university hospital where there's a medical students, and there is a residence, and there's an environment for teaching, and the fellows should have this mentality of teaching. So even if you go to a program, uh, basically it does not have this fellowship, try to go to a program where they are a university based, because I felt this is really really important during my interviews. Everyone was basically, if you graduated from a program where it's just a community hospital and it does not have a university name, it's your chances to match is a little bit slimmer. So we'll go to the next question. Do you recommend taking step one after finishing basic science, or along with step two after medical school as a foreign medical graduate? That's the first part. There's another question, but if you want to answer that, Dr. Mason.
Um, for us in medical school, our basic sciences. I mean, granted, USF is stronger in terms of its clinical rotations than it is like basic science, but all of our our basic science lectures are aimed at teaching us what we need to know for the step one. So, I mean, in the United States, that's that's how things work, just because your curriculum is that way, and then it's you need to know all of this information before you go into your clerkships, because you have to have an idea of what's going on before people let you do things in the hospital. But for a foreign graduate, I just don't know how strong your basic science curriculum is, um, for you to take step one before you graduate. So, I mean, if you that's the only thing. I mean, it's if you were to do it on your own and just self-study so that you could take it after your basic sciences, I mean, I feel like the timing would be ideal in terms of your medical training, and it would certainly help you if you were to come and do rotations or research in the United States if you already have that done. But it would just have to be a lot of work on your own. I mean, even in the United States, a lot of step study is self-study, um, and you can only get so much from the curriculum. So if you do it on your own and make your own regimented schedule, where you I guess go over pathoma and go over Pathoma and the sketchy series and like really go through your world and the question banks, then I feel like, and you take practice tests and you find that you're doing really well, I would recommend, I mean, it would be to your advantage to take it earlier. It would just depend on your comfort level. I mean, Abdullah's the one that is a foreign medical graduate, so I don't know if you could speak
Yeah,
more
I
to
mean,
that.
to tell the truth, I had this aim. I was aiming when I was a medical student in Damascus University. I wanted to take my step one during my medical school, but I felt it's gonna compromise my medical training. I felt that I'm gonna really ruin I'm not gonna be able to focus on both. To carry بطيختين يعني بنفس الوقت is very hard. فأنا I tried initially, but I felt it's not gonna work out. And there is a one good thing. There's basically when you finish your training, there is a gap between the time we graduate in Syria and the time we start a match, and this gap of time, it's almost like 8 months or so. So I think this is a good time to finish your steps, either like taking the step two CS or taking the USMLE step one or two. But definitely during your the 6th year, during the last year of medical school, during that year, you can focus on one of the steps. I remember I took step one and step two in the last year of medical school in the 6th year, and that was really prepared me very well when I came to do my elective here in the United States. I did the rotations here, and I felt I was really well prepared because I took my step one, and right away I took my step two. And when I came to the rotation, I felt like I was really well prepared. I was competing. I felt like I was able to answer questions that none of the no one from the team would be able to answer, like neither the fellows or the residents or even the American medical students. So if you do that, if you try to keep reading during your medical school, but don't rush it up, because the scores is really important. The scores for international graduates is it's really what everyone's gonna look at. You're gonna get filtered based on your scores, not based on anything else. So if you feel like you are ready and you're scoring like my son, mashallah, in the 260, I didn't have a chance. I didn't score that high. So if you are scoring 260s in the NBME and 270s, yes, go ahead and take your exam, even if you are in the third or fourth years of medical school. But if you are not scoring that high, don't risk it, because you're gonna feel more confident the in the 5th year or the 6th year in the medical school to take the exam, and your score is gonna be much higher because you finished the training and you know what they are talking about. And most of the exam you will see in the medical school in Syria, the first 2 3 years, it's not clinically oriented at all. It's a basic science, and most of the questions in the step one, it's really clinically oriented. Even the bio like the biochemistry, it's really the exam. It's clinically oriented. They will start with a clinical vignette, and it will go all the way to the basic questions. But everything is basically it's a clinical oriented exam. So if you take it and you are in the 3rd year or 4th year of medical student in Syria, you're not gonna score high unless like you are really a genius who took probably the time to do thousands of question before going to that exam. I would not recommending. I don't recommend taking it before you graduate or before the last year of medical school.
It's like important to keep in mind too that like in the United States, when I say like, oh yeah, we took it after 2 years of medical school, our undergraduate studies, like before we get accepted, is your first year, 3 years of medical school, like overseas. So for me, if I'm taking a second year of medical school, that means I took in terms of overseas or the foreign grads, that means it would be like you taking it after your 5th year of medical school. So certainly not after so everything Abdullah said, I totally understand what he's saying. I just wanted to clarify that there's nobody really taking it that early on in terms of your scheduling. even in the United States. So,
Right. Okay. Next question. What are the competitive scores considered? Like, what are the considered competitive scores in these days? We
um,
had different scales when I was when I applied to the match.
so in the United States, so for an American graduate MD, and a competitive score is a 240 or higher, which would correlate to this is on the step one. So on the step one, it's a 240 or higher. On the step, which is an 80 percentile or higher, right? This is for a foreign graduate, it would certainly have to be higher than that because you need to have something that's going to differentiate you or make them want you more than the American graduate. So I would I wouldn't make 240 my benchmark, but if you're over 240, you're still in a good area in terms of matching, especially in internal medicine. The average step one score that they accept in internal medicine is around the 220s, I think about 221. In pediatrics, I feel like it's a little less than that. Psych is around the same area. If you want to do surgery, it's actually in the same area. It's not for American graduates. I know it's different for foreign graduates. It's not more competitive. It's just that it's again about the whole connections thing. In surgery, it's just about a lot more about who knows who's going to write you a letter. So that's kind of where that makes a difference. And then once you start getting into more competitive things, if you're, just to give you a comparison, for derm, if you don't have anything like for derm, ENT, plastic surgery, at that point, like ortho, they actually set benchmarks where their screening score is when you submit your ERAS is like 235. So if your score is less than that, they just throw your application honestly in the garbage. For medicine, I think it's a 200. So if you have over a 200, nobody's going to just throw your application away. But for them, for like the competitive specialties, the average is more like the 246, 245, like plus. Honestly, the 250 plus range is for American graduates to be competitive. So just keep that, like, if that's for an American graduate, you should certainly be aiming higher. But to be competitive in general, in anything, it should be over a 240. If you're trying to go for medicine, the average is a 220, and I would still aim for a 240 because you need to make yourself seem better than the American graduates that are applying. For step two, I know people brush it off like it's not as important, whatever, but it's certainly like it's imperative. Like you have to have your step two score to apply for the match. I know it's not required, but all of the American graduates have their step two done. So you're at a disadvantage if your step two score is not there, because if an American graduate has a step two score and they did well and you just don't have yours, well, they're just gambling on you because they don't know what you're going to get on your step two. So I would certainly try and have it done before you apply for the match. And then you have to do, people say you have to do the same or better, but just keep in mind that the same score, like step two, getting the same score on step two is actually a lower percentile than getting a score on step one. So like, let's say hypothetically that a 250 on the step one is 88th percentile, then a 250 on the step two is like, I think it's about like 4 or 5 percentile less. So you're now in the 82 percentile range. So it's not doing the same if you get the same score. It's actually kind of doing worse. So just to keep that in mind that, the percentiles are different. And so the scores don't mean the same thing. Yeah.
Agree. Okay, next question. As an international graduate, I find Kaplan has more explanations but less organized than Step Up. So should I do both?
Is this for step one or for step two?
They did not specify actually,
Um,
but
for,
I think Kaplan. We do that. We do Kaplan for Step One and Step Two thing. Let me see. It's very hard to
I
tell the questions, but I think the plan we used to do when I did my step 2 and step 1, we used to do both. We used to do uh, actually, some people used to do Kaplan, some people used to do step up for medicine. I think he's wondering which one is better.
For step two, I personally don't like any of the Kaplan materials. I think Step Up to Medicine, that's what everybody in the United States is using. It's certainly like there's no like amazing best resource for step two, but that if you had to pick the best one, I feel like Step Up to Medicine is the best. Kaplan, the only thing that I know that they have for step two is the Master the Boards book, which is just not in depth enough. I haven't actually went through other Kaplan materials because they're not really popular here. Especially after step one. I know you guys for step one use a lot of those like Kaplan lectures. To be honest, I try to use them. They're out of date. They don't really focus on the most pertinent stuff. They weren't my favorite, to be honest. They don't even, I mean, UWorld is just far superior to Kaplan. I know a lot of people use the Kaplan question banks for step one. Um, and people, I mean, a lot of people in my class liked it, but UWorld is better. If you have time for two question banks, then it's certainly not going to hurt you to do two question banks, but don't let Kaplan take away from your time on UWorld. But if you have extra time, then it's not going to hurt you to do Kaplan questions, if that makes sense.
Yeah. Next question. I almost end USM Word questions and taking all notes from there. Do you think I should review the books you suggested, or USM Word notes are enough?
If you've been through all of USMLE World, it's I would assume that all of your foundation is there and you should know everything. Not everything, but you don't need to be creating a foundation anymore and reading books. At this point, I would take a practice test and see where I'm at. And if you're weak in a particular subject, then maybe use the book for that particular subject to strengthen your weaknesses. Because there's nothing really that a book is going to offer over UWorld because it's so thorough. So that's what I would do.
Okay. Next question. What's the best way to study emergency medicine, since there are a few questions in the USM Word about it?
Um, I think that's like those are like more of the trauma surgery type questions. Um, I mean, for those questions, I didn't use a particular book. The Pastana surgery book um does cover, like trauma scenarios and goes through like what you would do with the algorithm in terms of that. That's something that I honestly, struggled with in the beginning. So what I did is that I went through all of the UWorld like trauma type questions and actually just literally copied their algorithms down and okay, and then and wrote them down like, you know, because there's no good algorithm or resource that goes through that. So like for each scenario, for blunt abdominal trauma, for head and neck trauma, like this is what you need to do. I mean, usually the answers in emergencies always your ABCs, like airway, breathing, and circulation. That's almost always the answer. And then anything else in terms of trauma or emergencies that you should know, that you would need to know, would be covered in your internal medicine questions. I mean, because they're so comprehensive, like you're gonna have all the emergencies in those questions. But I would just read the Pastana stuff and focus on the UWorld questions.
Okay, we have last question. Dear doctors, what do you say about med study books for internal medicine? Are they good source for study?
Med study?
Yeah, I will answer this question because I think, do you know med study?
No, I was gonna say I have no idea what that is.
Okay. So med study basically it's an internal medicine board preparation materials. It's not for step two at all. But here's the thing. It's really it's really comprehensive. It's at the level of internal medicine board. A lot of people they used to study them for step two while back in Syria, just because they are way too much, of course. And the more you know, the more you can remember. Hopefully, the more you can score. But as Dr. Wassan said, the exam is not how much you read; it's how many questions you do. So that's number one. Number two, mid study is very comprehensive, very long. It's a huge, even for internal medicine. I'm taking my internal medicine board, and no one I know actually from my batch or from my colleagues from different programs, they are doing the mid study because it's really long, and you cannot really keep. You don't have time as a resident, of course, to study all these materials, and the practical life really prepare you very well to take the board. And we don't, even in internal medicine board, we don't take it. If you have time to read it as a medical student for the shelf exam, as they call it here, or حتى تقدر اذا عم تدرسهم لتعمل منيح بالجامعه. وهذا اغلبنا عملهم. انا قريت الميد ستدي لما كنت بالجامعه لحتى اتعلم يعني منيح بالباطني بالجامعه. وبعدين لما كنت عم احضر ستيب 2 رجعت لهم ببعض الامور اللي ما كنت عم افهمها ممكن. بس بكره بتشوفوا بس تبلشوا تحضروا للفحوصات للستيب 2، بدك يكون عندك مرجع يعني مثل كتاب واحد بالاخير تعمل له وجه سريع بالوجه الثالث. اذا بتتذكروا، ما بعرف شلون عم تحضروا، بس نحن كان عندنا وجه اول، وجه ثاني، وجه ثالث. الوجه الثالث مدته عاده بتكون ما بتتجاوز ال 20 يوم ل 30 يوم، وعاده بتكون في مراجعه سريع على هذا المرجع. فمستحيل تقدر تراجع الميد ستدي لانه كبير كتير، يعني بيطلع تقريبا 8 كتب. ومستواه اعلى من مستوى الفحص برايي، وقرايته يعني كثير صعبه لانك تقراه لستيب 2، لانه اصلا يعني مكتوب بطريقه ما في ولا يعني كل كلمه مكتوبه بالميد ستدي هي عباره عن شيء بينحفظ او بيندرس. صعب انك تقدر انك تحفظ هاي الكميه وتحضر حالك للفحص. فانا I don't recommend it. راح تضيع وقتك اذا بتعمله مثل ما حكت الدكتوره، انك تعمل يو اس ام وورد منيح وجهين وثلاثه، او انك تضيف اسئله، يعني شو اسمه، اسئله من مراجع تانية مثل كيو بانك او اي شيء تاني، احسن من انك والله تقرا نظري وتقرا كتب. لانه بكره بتشوفوا ما مخك ما حيقدر يتحمل، او ما حتقدر تتحمل انك تراجع هاي المعلومات. ممكن تقراها هلا، بس الفحص بعد بشهرين مستحيل تقدر تراجع هاي الكميه الكبيره من الكتب. نحن هلا تقريبا نحن حاليا ما عاد في عنا ولا سؤال. بدي اشكركم جميعا على وجودكم معنا. كانت كثير محاضرة ممتازة. بدي أشكرك دكتورة على وقتك. أنا ما بعرف إذا في حدا حاليا، في عالم عم يكتبوا أسئلة. ثانية واحدة، معك شي دقيقة بس رح نجاوب على كم سؤال تاني.
Yeah, that's fine.
أوكي. Salam all. For us foreign graduates, we did not have an idea that we need to prepare for step 2 CK during our clinical years, so we did not cover those textbooks you mentioned at that time. How much time do you suggest?
I mean, okay, so like the textbooks are really more of a recommendation in terms of if you are weak on a subject, then these are the materials that I would recommend. I mean, for most of the subjects that I studied, I didn't really use books other than for psych, surgery, and internal medicine. So if you feel like you're weak on a subject or you don't have a foundation in a subject, I mean, if you had to pick a book, I would only read Step Up to Medicine. That takes, I mean, it's a pretty thick book. It's like 500 pages, and it's a pretty dense read in terms of, it's just a lot of information that you would be reviewing. But I would, for me, when I read it, I tried to do at least 2 to 3 subjects in that book a day. And I didn't really fixate on like trying to memorize every detail because I knew that all of that would be reviewed when I did all of the medicine questions. So, I mean, I, it's nice to have these books as a reference, but don't let it sacrifice or take up too much of your time from the questions, or I guess make you inefficient, just because using too many resources can what I learned for my step one, I had way too many resources when I was studying for step one. So I made sure not to make that mistake when I took step two, because it's just too much and you get caught up in all the resources and then you just get stressed out and anxious. So I mean, I would just recommend like the psych, the surgery, like the psych first aid if you needed a book, the Pistana for surgery, and then Step Up to Medicine. And like Step Up to Medicine would certainly be the priority. But if you're on a time crunch or you don't have a lot of time, I would make UWorld my priority over all of that. So it just depends on how fast of a reader you are too. Like I guess that's a personal thing, but I wouldn't spend weeks and weeks on these books. It would be max like 10 to 15 days on reading.
تمام. شكرا كتير دكتور ميسان. I wish you all great weekend. وإذا في عندكم أي استفسار فيكم تحطوه على الإيفنت بيج. أنا رح أحط إن شاء الله الإيميل تبع الدكتورة ميسان على الإيفنت بيج، مشان إذا حدا بده يبعث لي أي استفسار أو مشان النوت. شكرا كتير جميعا، و have a great weekend ويعطيكم العافية. شكرا كتير.
شكرا، السلام عليكم.